Good afternoon, everyone.
Good afternoon. Good afternoon.
I'm pleased to be here today at the Garden House Apartments in Maywood to launch a COVID-19 point of distribution pod site. I'd like to acknowledge the folks who've joined me today. Garden House residents Eddie Mae Ferguson and Linda Blunt, Israel Rocha, head of Cook County Department of Cook County Health, period, thank you. Speaker Chris Welch, State of Illinois, House of Representatives. State Senator Kimberly Lightford, who will be joining us shortly, Majority Leader Lightford. Commissioner Brandon Johnson. This is his district. Thank you, Commissioner Johnson, for welcoming us. Maywood Mayor Edwina Perkins, who's right next to me on my left. Willie Norfleet, who's village manager in Maywood. Trustees Miguel Jones and Isaiah Brandon. Clerk Viola Mims and Princess Dempsey. I'd also like to acknowledge Dr. Rachel Rubin, who's co-lead of the Cook County Department of Public Health. This point of distribution, or pod, will serve as a site for the senior residents of the Garden House to receive the COVID-19 vaccine. We'll be supplying 100 doses today, 100. I'd also like to thank Governor Pritzker and the Illinois National Guard for their support, and the leaders from the Cook County Department of Public Health for their work to get this site up and running, as well as other vaccine sites across suburban Cook County that have opened over the last month. The point of distribution sites are a component of our equity-focused approach to vaccine distribution. We're meeting residents right here where they are, at their homes, to provide access to the vaccine. Right now, we're still in phases 1A and 1B. That's residents over 65, essential workers, frontline workers. We expect this phase to last for some time, but I'm proud of the progress that we've made and look forward to expanding access to the vaccine. I know how hard this last year has been. We've seen that seniors, particularly Black and brown seniors, have been disproportionately impacted by the pandemic, and many of us have lost friends and neighbors to the virus. I'm sure that you're missing visits from friends and family, sons and daughters, grandchildren. I know that I am. But we have reason to believe, now that the worst of the virus is behind us, that we will soon be able to hug our grandchildren and visit our friends. Last week, President Biden said that we're on a pace for all American adults who want the vaccine to receive one by the end of May. Yesterday, it was reported that President Biden directed the Department of Health and Human Services, HHS, to procure an additional 100 million doses of the Johnson & Johnson vaccine. That's the one-dose vaccine. This is very good news because we can more quickly protect our residents and our communities. We've been through so much for the past year, but I'm cautiously optimistic about the future and so grateful to see the Garden House residents here today receive their vaccines. Now, I'd like to turn our program over to Mae Ferguson and Linda Blunt, who are residents of this building, to share a few words.
Hello, my name is Eddie.
Tell you what, could you take your mask off?
I take my mask?
Yes, just please, because they can't understand you otherwise, okay? Pull it down, there we go, and push that right there.
Okay.
There you go.
My name is Eddie Mae Ferguson. I'm a resident here at the Garden House, and I'm very excited about taking the vaccine because I miss everyone. I miss my family. I miss going to church. I miss hugging my grandkids, and it's just be so wonderful once we can get back together and everything. And I just want to thank God for it, and to thank God that we can get this here too. That's all I have to say.
Hi, my name is Linda Blunt, and I'm so glad that we're taking the vaccine.
I miss my family so much. My daughter's in New York and my son is in Las Vegas. And I miss seeing my grandkids.
Yes, yes.
And when you're in your apartment all alone, you just get kind of like sad. And I'm used to traveling a lot. Now I can start back to travel.
Yes, you can.
And I really appreciate it, and I love living here at our garden house. We have some good people in here. And I'm trying to say I love everyone, and I'm tired of just being here, sitting here alone. So I want to get back out and begin to mingle with people. And I thank each and every one of you.
Thank you. So I'd like to thank Eddie Mae Ferguson and Linda Blunt, residents, for their comments and insights. I'm going to ask Israel Rocha and then Speaker Welch and Commissioner Johnson to come to the podium in that order.
Good afternoon, everyone, and thank you so much for joining us here today. I want to start by thanking President Preckwinkle and all the elected leaders joining us today for their support as we continue to fight COVID-19 and ensure vaccine equity across Cook County. Today, we will administer our 200,000th dose. That's 200,000. And I know we have asked individuals to be patient, and it's a very special milestone that would not have been possible without our large mass vaccination site and special tiered pods like the ones that we're at here today to be able to bring relief to the communities that have been hardest impacted by COVID. But if we look at the timeline, we've been doing this now for about 6 weeks. It took us about 4 weeks to hit 100,000. Now 2 weeks later, we're at about 200,000, and we hope that we keep increasing with that pace. I know it feels sometimes that we are not moving forward, and we keep asking questions, when will be our time to get the vaccine? And we ask you to be patient and want to reassure you that that time is coming. You can see that things are improving, the availability is increasing, and every day we're getting to more areas. We're opening more sites. We're creating new opportunities for individuals to get vaccinated. I'm pleased that we are here at the Garden House of Maywood to provide vaccines to the residents, their families, caregivers, and the employees of this facility. Over the coming weeks and months, we are looking to bring COVID-19 vaccine into the areas where people live that have been most impacted by COVID-19. Pop-up events like this allow us to hyper-focus on vulnerable populations and fill in the gaps as we look at data to make sure that everyone is getting vaccinated and that everyone has an opportunity to be able to get their shot at the vaccine. Cook County Health has long advocated as a health system driven by equity. Our longstanding mission is based on ensuring equal access to the care of people in need, particularly when they need it most. The work and the meaning behind that mission has never been more important than it is today. That is why pop-up locations like this are so vital in our fight against COVID-19. We need to make sure that everyone has access to the vaccine, and that includes bringing them directly where they live, where they work, where they are, and how they can be able to be ensuring that we are bringing availability without barrier, equitably and efficiently to individuals in need. I continue to be proud of the amazing men and women of the Cook County Health System and ensuring that they are working tirelessly to ensure vaccine equity, and look forward to continuing to expand our vaccination efforts, and very soon hope to be coming to all individuals who are in need. Again, we ask individuals to be patient, but we do want to give you encouragement that we are having more vaccine. You can see every time through these announcements that more vaccines are opening, more sites are coming, and we are bringing more vaccine into the community. So thank you to everyone for their partnership, for their assistance, and for letting us make today possible. Thank you.
Good afternoon, everyone. My name is Chris Welch, W-E-L-C-H. I am State Representative for the 7th District, Speaker of the Illinois House, and you are in my district. In fact, you're in my hometown. I am really proud to say that as a kid, I went to school 2 blocks away from here, and I grew up right down the street at 307 South 2nd. So I am really honored and privileged to be standing here today, so many years later, as the Speaker of the House, standing alongside my good friend, our Cook County Board President, making sure that this community is not overlooked. It is extremely important. Here we are a year into this global health pandemic, that we make sure hard-hit communities like the village of Maywood are not overlooked. Equity is at the center of every decision that we make when it comes to issues like surviving COVID-19. And so I want to thank the County Board President and Mr. Rocha and the entire team for the work that they've been doing, because they are working extremely hard to close the disparity gap. We know the gaps exist. COVID-19 only shined a light on what we already knew, gaps that existed long before we ever entered this pandemic. But they are working really hard to close the gaps at such a critical time. To be here at the Garden House today, putting vaccines in the arms of seniors, the most vulnerable. That's what it's all about. We are closing the equity gap. We're getting another step closer. There's more work to do. But before I leave, I also want to thank Mayor Perkins and the village trustees that are here, because they are champions for this village. They have been speaking up and speaking out and making sure that the village of Maywood is not overlooked. And so we hear you, Mayor. We hear you, trustees. Thank you, Madam President. Thank you, County Board. Really honored to be here with all of you today. Let's get those vaccines in the arms of our seniors. Thank you all so much.
Good afternoon. Good afternoon. My name is Brandon Johnson, Cook County Commissioner of the 1st District. And before I get into too many of our thank yous to Miss Linda and Miss Eddie Mae, my children probably could benefit with having a few more meemaws and papas. So I know how much it means to you all as grandparents to connect with your grandchildren. And let me just say, it is equally important for your children to connect you with our children. Because my wife, who has been at home with remote learning for the last year, she would take about any meemaw right now. So Gardens, you just might have 3 black children show up here once these vaccinations get into your arms. They're my kids. They're really good kids. They're potty trained and everything. But to the board president, Tony Preckwinkle, thank you for your leadership and your commitment during these very remarkable and difficult times. It's why leadership matters, that we have lives that are at stake every single day in our county and throughout our country. And without leaders like President Preckwinkle that are committed to justice and making sure that those communities that have been deeply impacted by many of the failures of these systems throughout ages, without that type of leadership, we would not be experiencing this moment today. As dark as these days have been, I'm also very humbled to be joined by the Speaker of the House, who's a real champion for equity and justice. And as you just heard from him, he's a neighborhood brother. And he doesn't lose sight of that. And he has taken his leadership to the halls of power to make sure that communities in the 1st District like Maywood and Bellwood and Broadview are well represented. And of course, to the champions here in this community, our Mayor Perkins and the trustees, Miguel and Isaiah, thank you both. And Dempsey and our village clerk. There's so many folks that are committed in this moment that brings me to a place of comfort. The harsh reality, sisters and brothers, is that with all of the deaths that we've experienced over the course of this last year, we know that roughly 85% have been seniors. An entire generation that made my life possible have been devastated by this wicked pandemic. And now, hopefully, we can move forward with better direction and clarity so that the lives that have been lost, the lives that we'll never get back, that we can save other meemaws and papas, that we can save other aunties and uncles from losing their lives because of failed leadership. And so thank you again, Madam President, for your commitment. And thank you to the folks who are part of this incredible establishment to ensure a little bit of hope and some more clarity to make sure that we beat this disease and this virus. Thank you.
Thank you. We are definitely in Speaker Welch's House District. We're in Commissioner Brandon's County District, and we're in the city of Maywood. And again, I want to acknowledge Trustees Miguel Jones and Isaiah Brandon and Clerk Viola Mims for being with us, and I'd like to introduce the Mayor of Maywood, Edwina Perkins.
Just like to say good afternoon.
Good afternoon.
To the greatest town in the Proviso area, and that's the village of Maywood. And then I'd like to say good afternoon to the greatest person by the name of Cook County President Preckwinkle. She is a lady of her word. And I just want to say thank you, and to the thank you, and God bless you.
Last, I'd like to bring up Dr. Rachel Rubin, who's co-lead of the Cook County Department of Public Health and has her own personal tragedies related to COVID-19. Dr. Rubin?
Yeah. Thank you, Madam President. Been on the speaking tour a little long. My throat's a little gruff today. So I want to say good morning or good afternoon to everyone here. And I want to thank this incredible group of leaders, these community leaders that have joined us today. I'm honored to share the stage, also especially with our two residents, Ms. Eddie Mae Ferguson and Ms. Linda Blunt, and their heartfelt words of support for this program. And I thank them especially for standing up with us here today. I'm happy to be here to be part of this landmark pilot program of the Cook County Department of Public Health and the Cook County Health System. I'd like to bring this conversation back to public health a little bit and to put today's events into the larger context. The Cook County Department of Public Health has been working on COVID-19 every single day for 14 months, and I'm proud of the work of our department, which was only 150 people with the jurisdiction of almost 2.5 million residents. This vaccination program, getting vaccine into the arms of as many of our 2.5 million residents, is the biggest job yet and the largest public health project of our lifetimes. Our goal is to reach herd immunity. This is about 75 or 80% of our population to receive the vaccine so that everybody can be safe. As we stand here in this marvelous facility, I think of my own personal losses to COVID. But I represent just one family among the millions affected with lost loved ones worldwide. Vaccination is the key to stopping further deaths and severe illness from this deadly virus. We owe it to our parents and grandparents to not only get this right, but in many cases to get the vaccine directly to them. This mobile program is an important way we will achieve our equity goals in Cook County. This program will serve as a model for workplaces, for essential workers, for our homebound, for those who face transportation challenges, for our homeless and housing insecure residents, for our underserved communities of color who require services in their own neighborhoods. In short, our most vulnerable populations. It is a privilege and honor to help stand up this program of on-site vaccinations for our seniors where they live. Our public health department of 150 has added almost 275 workers to stem the tide of this virus through contact tracing and other initiatives that are necessary to effectively fight this pandemic so that we can see that light at the end of the tunnel. And I'm beginning to see glimpses of that today. We will work hard to reach that 75% goal of herd immunity, but we will work even harder to ensure that 75% matches the county we serve. We are listening, acknowledging, and addressing the hesitancy in vaccine and mistrust in government that is frankly well-deserved. To do this right, we have to work even harder than we have in the last 14 months, and we will achieve our goals as we work together in this fight. Thank you so much, and I turn it back to the President.
All right, we'll take your questions. I want to. We're going to start with the reporters in the room. Oh, just a moment. I believe that Majority Leader Lightfoot is with us, and we want to give her a chance to say a few words. I want to acknowledge David Jones, who's our sign language interpreter, who's with us today. Majority Leader Lightfoot, do you want to come right to the podium, please?
Yes. Yes, ma'am. Thank you. I just rushed in from downstate, so I'm happy I made it on time without being stopped. Well, good afternoon, everyone, and thank you so much, President Preckwinkle, and to Commissioner Brandon, and Speaker Welch, and Mayor Perkins, and everyone standing here. I didn't get a chance to glimpse all that is assembled here. But thank you so much for coming to the village of Maywood, to my hometown, and making sure that this pop-up vaccine site was available for the elders in our community. And our elders have felt the impact of this virus more than most. We've seen how deadly COVID-19 can be for our elder citizens, and the measures used to keep them safe, while necessary, have been extremely isolating. We must care for our seniors and look after their health and well-being. Prioritizing their vaccination means the number of deaths caused by this virus will be dramatically reduced, which is why I'm thrilled to be here and see over 100 seniors receive their vaccines today. Vaccination is the pathway to getting families back together and our lives back to normal. It's exciting to see people over age 65 and frontline essential workers get their vaccinations. Even though suppliers are still limited, I urge people to be patient. Eligibility is continuing to expand. If you're eligible, I encourage you to go to vaccine.cookcountyillinois.gov to register and set up an appointment. I'm also pleased that many of the vaccination sites can easily and equitably serve our diverse communities. Making sure minority communities who have been hit so hard by this virus have access to the vaccines is very important to me. I also want to take this opportunity to remind everyone that even though vaccines are starting to be administered, we still need to take precautions. Please keep wearing your mask, keep watching your distance, and keep washing your hands. If we are all patient, respectful, and work together, we will get to the other side of this pandemic. The more cautious we are, the more our communities can reopen. That means more opportunities to safely support local restaurants and other small businesses. I know this winter has been especially hard, but we're on the right track right now. Let's all do our part to keep it that way. Again, thank you for allowing me to join you, and thank you, President Preckwinkle.
Thank you. We're very grateful that Majority Leader Lightfoot and Speaker Welch and Commissioner Johnson and Mayor Perkins could all be with us, as well as all of our other participants this afternoon. Where is Nick? Yes. Dr. Rubin, do you know the answer to that? Do we need to get somebody from the building? All right, we'll ask Dr. Rubin to respond.
We are anticipating vaccinating 100 individuals today, which is the vast majority of the facility here. I don't know the total numbers, but it's almost everybody.
It's about a majority of everybody in the building.
Yeah, it's the overwhelming majority of people in the building. Yes. 160 residents, 144 units. We have 100 shots. So I presume that everyone who wanted to be vaccinated today is vaccinated. So people had the opportunity, the choice, and 100 people chose to be vaccinated. Okay, thank you, sir. You know, Israel? This is a point of distribution site, so this is for the particular people in this building, okay? So we have mass vaccination sites, we have our clinics, we have our hospitals, and we also have these point of distribution sites. Israel?
So I'm going to give you an advance warning. It'll be a little bit disappointing because we're not going to tell you the sites are, but we are working on programs with our public health department and our Cook County Health System that we have some programs that you will be hearing more of. Today is the start of Vaccines on the Go. So we go to locations where people live, where they work, and we're able to do that. We also have a program called Vaccines at Work that we will be looking at any areas that either had big outbreaks, were heavily impacted, or have difficulty times being able to get vaccines, how we can work with them. And those are all in time as more vaccine becomes available. We're also going to be doing programs for transportation assistance to make sure that any type of gap that has people getting challenges to come to either mass sites, to Vaccines on the Go, to our pop-up sites, or to our Vaccines at Work program. We're going to be doing everything possible. Again, the mandate is to make sure that we are doing everything as equitably, as efficiently, and as approachable as anyone can have as possible. So we're going to where people live and work. We'll be announcing them. A lot of these are going to be on rotating schedules, and then we'll also be coming to communities and schools as well, as you've seen from our Maywood site and from our Thornton Fractional site. We also are doing specialty pods. So wherever we can work, based on the rules of the CDC guidance, we start to make more availability, and we will be announcing the next sites. But those are the general strategies of the program, and they will be increasing as we get more vaccine.
We're going to move to reporters on the line. Alice from the Tribune, do you want to go first?
Yeah, thanks. Any requirements you're looking at or prioritizing when deciding which organizations you're partnering with for this pilot program?
Israel, the question is, what are our priorities in finding partners to do these point of distribution sites?
And I may also bring in Dr. Rubin different questions. But what we've done to looking at our equity strategy is that in partnership with our public health department, we have been able to look at all the communities based on how much vaccine they have received, the percent of vaccination in those areas, the impact of mortality and morbidity of COVID, and then also any social or economic risk factors that make it difficult to get to some of our other sites. And so there is a distribution we look at, and then we look at clusters of infection or areas that had greatest need or areas where there's greatest challenges. And then organizations have reached out to us. We have on our website, so if you go onto our website now, which is vaccine.cookcountyil.gov, on the top corner, there is a blue box that says organizational sign up. Organizations can sign up there. That information goes directly to our public health department, who is helping to coordinate this based on the risk criteria and the social factors and the availability of us to be able to operationalize these sites safely into the area. So we have a team who works very closely with them, but if you're interested as an organization, there is a way that you can sign up on our website. That has been active now for a few weeks, and those organizations are there. And then we also do our own research to be able to look at where we can operational these sites in the community. Thank you.
Okay, thanks. In total, how many vaccines have you set aside for this pilot program?
Israel, Alice wants to know how many vaccines we've set aside for this pilot program.
So again, with our public health department, we work every week and we look at the needs throughout the organization, throughout the cities. We have many partners. We have over, now probably approaching near 200 community partners. Those include FQHCs, pharmacies, points of distribution. We have our mass sites, and then we have now these pop-up locations. So every week that we get our allotments from the state, our public health department, and I really don't ever want to be in that job, make sure that they go very carefully distributing the vaccine based on need, based on how quickly partners are able to distribute that vaccine, and based on our CCVI index on community impact scores on where we can get to. So again, our measures and principles are always to do this equitably, efficiently, and geographically to make sure that everyone throughout our jurisdiction has an availability to get a vaccine in every way possible. And so we look at also transportation challenges, we look at availability. We know that people work different hours, so we work with partners that can have different hours to allow more people to get vaccine. and how many sites we can do it safely at. And that's the objective of our public health department, to do that objectively based on the science and data and availability of need and the amount of vaccine that we have. Thank you.
So it looks like it might be in flux. Can't put a definitive number.
Just a second, Alice, what's your question? We can't give a definitive number. No, that's quite true. All right?
Yes, hi everyone.
Hi, Kristen.
Okay. So we're getting a lot of questions from listeners and readers about, where they can get a COVID vaccine. I realize there are a lot of different places, right? But specifically for the United Center, when and how can people who live in suburban Cook County sign up for a vaccine there? Is that going to be, we've heard that might be rolling out this week, but I just wanted to get some details on that.
All right, Israel, Kristen wants to know how suburban people can sign up for the United Center vaccine.
Hi. So again, I'm going to give you what I know, and then some of this I would also ask you to please make sure we also visit with the city. But the way that we have been able to work with the city was that there was a set of appointments, roughly about 110,000 that were put at one time through ZocDoc, that was made available to everyone that was 65 or over, and it was available to make everyone statewide. Those appointments were there for them to sign up. That was a certain amount of time to ensure that by CDC guidance, the Phase 1A and Phase 1B populations had an opportunity to sign up for these vaccines. At the end of that period, which ended this Sunday, then there was those appointments came down. There are some available now for the city of Chicago. The state has some strategies to be able to get some more vaccines out, and we as a county are working to get some vaccines out. Remember that those vaccine appointments were over a series of weeks. And so the first few weeks are taken with what was available publicly. We are working right now strategically to be able to give those others to different availabilities. So I would say to keep checking back with the website. Go to ZocDoc.com for the city sites that are available. If you want to be able to, if you're a city resident, for individuals in the northern part of the county, we will have those details coming up hopefully next week as we're working to make sure that we have a process in place that is compliant with the requirements of FEMA and the state as we give those vaccines out. So we will hopefully have more information for you later on this week.
Okay, so the details on people who live in suburban Cook County, if they want to get a shot at the United Center, because right now they can't, right? There's no public way for them to do that. It really is sort of targeted outreach. But so those details are not going to be coming until next week, is that correct?
Yes. Israel says yes.
Okay. Okay. And if I could just one more, just kind of piggybacking on that, this week during the press conference that you guys here on Tuesday, obviously there's a big focus on equity and making sure that the rollout is equitable. Has the county identified certain zip codes or communities that you're specifically targeting in the suburbs?
All right, the question is the county identifying particular communities in the suburbs that we're targeting for the vaccine?
So yes, as we talked a little bit about earlier, our public health department using a CCVI index that looks at community scoring. CCVI stands for Community, that's correct, Community COVID Vulnerability Index. Had to phone a friend through Dr. Rubin, our senior medical officer. So it's a Community COVID Vulnerability Index, and that looks at mortality and morbidity of COVID, infection rates, and we also look at percent of vaccinations, and then we look at other socioeconomic factors that are limiting availability to vaccine. Those communities are prioritized. We have about 30 communities that have been highlighted as high vulnerability communities. Those are the communities that and these are 30 communities strictly in the suburban jurisdiction of Cook County, and those communities are being prioritized based on their scoring on the COVID Community Vulnerability Index that we are utilizing that takes those factors into account. And if you have questions about those communities, I would encourage you to reach out to our public health department and we can get you a list of that.